Welcome to the deep dive. You know, where we like to kind of sort through all that noise out there and bring you the stuff you actually care about.
That's right.
And today we're diving into, this is pretty fascinating, the world of Iscalimab.
Oh, yeah.
And it's all started because you sent us this article, and it's from SA Genie,
Yes.
and it's called Iscalimab, Advancing Research in Autoimmune Diseases and Transplantation. And let me tell you, just reading through this thing, it's got me pretty excited about what this could all mean.
Yeah, and I think you're right. To be excited, it's definitely a really interesting area of research.
Okay, so before we get ahead of ourselves, though,
Yeah,
let's start with the basics here.
sure.
What exactly is Iscalimab?
Yeah.
Because I was reading through this article, and they use a lot of technical terms, so I think just explaining it in simple terms would be great for our listeners.
Okay, well, think of your immune system kind of like a security system, right?
Okay.
Sometimes it gets a little overzealous,
Yeah.
attacking your own body when it shouldn't. And that's where Iscalimab comes in.
Okay.
It's what's called a monoclonal antibody,
Okay.
which is basically a super specific type of protein.
Okay, so it's like a specialized security guard that can kind of step in when things get out of hand.
Exactly, yeah, that's a great way to put it.
But how does it actually work? I mean, how does it know when to step in, and how does it stop this attack from happening?
It all boils down to this protein called CD40,
Okay.
which is kind of like the communication hub for your immune cells, right?
Oh, okay.
So Iscalimab, what it does is it targets CD40 and blocks it.
Mhm.
And what's really remarkable about this is that by targeting just this one protein, Iscalimab can potentially disrupt this whole cascade of immune reactions,
Wow.
offering a level of precision we haven't really seen before.
So by blocking CD40, Iscalimab is basically shutting down those communication lines that tell the immune system to attack.
Yeah, exactly. You can almost imagine it like, a group text message between a bunch of immune cells that just suddenly explodes with these frantic messages telling everyone to attack, right?
Yeah.
Iscalimab steps in, blocks that group chat, and kind of brings calm back to the system.
That's a great analogy. I like that.
Yeah.
So you mentioned the CD40L pathway.
Mm-hmm.
What exactly is that?
Yeah, so that's the pathway that we're talking about.
Yeah.
It's this essential communication pathway for a healthy immune response. But in autoimmune diseases or transplant rejection, it goes into overdrive.
Gotcha. So it's like the gas pedal gets stuck.
Exactly.
And what makes Iscalimab even more interesting to me is that it targets this specific pathway without suppressing the entire immune system.
Right.
That's what I was reading in the article, but it's kind of like shutting down communication completely. So is there any concern about making the body more vulnerable to other threats if it's not able to communicate as effectively?
Yeah, I mean, that's a great question, and it's something researchers are definitely looking at very closely. The goal is to find that sweet spot,
Right.
where you're blocking that harmful immune response, but without completely disabling the body's natural defenses.
So it's kind of like a delicate balancing act.
Yeah, exactly.
But let's talk about where this could actually make a difference, for people living with these conditions.
Yeah.
The article mentioned a few specifically, Sjogren's syndrome and lupus nephritis.
Right.
Can you talk about those a little bit?
Yeah, so those are both examples of autoimmune diseases where the immune system is basically attacking specific organs in the body.
Okay.
And for people who are living with those conditions, Iscalimab could be a real game changer because initial studies are showing it can actually reduce that inflammation and slow the progression of the disease, which is huge.
That's really promising.
Yeah.
And it seems like the potential applications go beyond just autoimmune diseases, right?
Oh, absolutely.
What about in the field of transplantation?
Yeah, organ transplantation is a really complex procedure. And one of the biggest challenges is preventing the recipient's body from rejecting that new organ.
Right.
And currently, patients have to take these really powerful immunosuppressant drugs,
Right.
which can have a lot of side effects.
Yeah, we've talked about that on the show before.
Right, exactly.
So how could Iscalimab change that?
Well, the thinking is that by blocking that CD40 pathway, Iscalimab could actually prevent the immune system from attacking the transplanted organ in the first place.
So it's like stopping that rejection before it even starts.
Exactly, yeah. It's all about preventing that initial immune response that leads to rejection.
Wow.
And if Iscalimab can do that effectively, it could potentially reduce or even eliminate the need for those really harsh immunosuppressant drugs.
That would be a huge step forward.
Yeah, absolutely.
So now that we have a good understanding of how Iscalimab works,
Right.
let's kind of explore these exciting areas where it could make a real difference.
Yeah,
Like
absolutely.
we were talking about with transplantation.
Right.
This is where it gets really interesting to me. I mean,
Yeah.
just imagine a world where organ transplant recipients don't have to rely on those really heavy-duty immunosuppressants with all the side effects and everything.
Right.
That's the hope that Iscalimab is offering, right?
It is, and it's not just about reducing those side effects either.
Yeah.
It's about actually improving the long-term success of those transplants.
Right.
Because the current immunosuppressant drugs, they can really weaken the immune system,
Of course.
leaving patients vulnerable to infections and all kinds of other complications.
Right.
So if Iscalimab can offer a more targeted approach, it could lead to much better outcomes for those transplant patients.
That's an incredible prospect, really.
It is, yeah.
Are there any other areas where Iscalimab is showing promise, maybe beyond just transplantation and those autoimmune diseases we talked about?
Yeah, so researchers are also investigating its potential in other conditions like diabetes and myasthenia gravis.
Okay.
It's still pretty early days for those,
Sure.
but the possibilities are, they're really exciting.
Right. This is all sounding pretty revolutionary, I have to say, but I'm curious, how accessible is this kind of cutting-edge research,
That's a great question, and it kind of leads us into this concept of biosimilars.
Okay.
You can think of them kind of like generic versions of biologic drugs,
Okay.
which can make the research a lot more affordable and accessible to more people.
So it's like opening up the research field to a wider range of scientists and institutions.
Exactly, yeah. It's kind of like democratizing the research in a way.
I like that.
And that's where Assay Genie comes in.
Right.
They actually offer an Iscalimab biosimilar,
Oh, wow.
specifically for research purposes.
Interesting.
So this allows scientists to really dive deep into Iscalimab's mechanisms and explore its potential without, breaking the bank.
That's great. So it really opens up the possibilities for research.
Yeah, exactly.
So it sounds like biosimilars could really be a game changer in terms of cost and accessibility for this kind of research.
Absolutely, yeah. They have the potential to really accelerate the pace of discovery and bring these therapies to patients faster.
That's fantastic. So it's not just about the science itself.
Right.
It's about making sure that science is actually accessible to the people who can do something with it.
Exactly, that's the key.
Well, I think this is a great place to kind of pause for a moment.
Yeah.
When we come back, we'll delve a little deeper into some of those potential applications of Iscalimab.
Sounds good.
We'll be right back after a quick break.
Yeah, and that accessibility is really crucial, for driving innovation.
Right.
Because if more researchers can actually work with Iscalimab,
Right.
then we can accelerate the pace of discovery and potentially bring these therapies to patients faster.
So it's really about kind of democratizing the research.
Exactly.
Giving more scientists the tools that they need to explore this potentially groundbreaking treatment.
Yeah.
But I'm also curious, with a tool this powerful, are there any downsides? We're talking about interfering with a pretty fundamental part of the immune system here.
Yeah, no, that's a really important point. And it's
Yeah.
definitely something that scientists are very mindful of.
Right.
While the early research is showing a lot of promise,
Right.
it's still crucial to understand the long-term effects of actually blocking this CD40 pathway.
Okay.
It's kind of like any new technology.
Right.
We need to proceed with caution and make sure we're not creating any unintended consequences down the line.
So what kind of unintended consequences could we be talking about?
Well, one possibility is that by suppressing part of the immune system,
Right.
we could be making the body more vulnerable to other infections, right?
Okay, so it's kind of like,
It's a delicate balance.
yeah, researchers are walking a tightrope, trying to dampen this harmful immune response without actually compromising the body's ability to fight off these other threats.
Yeah.
Are there any other concerns, maybe in terms of, who gets access to this treatment if it does become available?
Yeah, absolutely. That's another really crucial consideration.
Okay.
We need to make sure that if Iscalimab proves to be effective, it's accessible to everyone who needs it,
Right.
We don't want to see a scenario where only certain groups of people can afford it or benefit from this kind of treatment.
Right. It's about ensuring equity and access
Exactly.
for everyone. Yeah, that makes a lot of sense.
And of course, with any new medical treatment, there's always the question of cost.
Right.
Biologic drugs like Iscalimab are complex to manufacture,
Yeah.
which can make them expensive.
Yeah.
That's one reason why the development of these biosimilars is so important. They can offer a more affordable alternative.
Right.
potentially making these treatments more accessible to a wider range of patients.
Okay, so can you give me an example of how biosimilars have kind of made a difference in other areas of medicine?
Yeah, absolutely. I mean, think about insulin, for example.
Okay.
It's a life-saving drug for people with diabetes. But the cost of insulin has been a huge barrier for a lot of patients.
Right.
The introduction of these biosimilar insulin products has really helped to bring down the price, making this essential medication much more affordable for people.
So that's a really powerful example of how biosimilars can actually make a real difference in people's lives.
Yeah, absolutely.
That's great.
And it really highlights the importance of investing in that research and development of these alternatives. It's
Yeah.
not just about scientific breakthroughs. It's about making sure those breakthroughs reach the people who need them most.
Yeah, that's a really important point.
Yeah.
So we've talked about the science behind Iscalimab, its potential applications, even the economic factors at play.
Right.
But it feels like there's a bigger picture here, something about the future of medicine itself.
Yeah, you're hitting on a really key point.
Okay.
I mean, Iscalimab is just one example of this new wave of therapies that are really revolutionizing how we approach disease. You know, these therapies are highly targeted. They're focusing on specific pathways in the body
Right.
rather than using that broad brush approach we've seen in the past.
So it's like moving from a sledgehammer to a scalpel.
Exactly.
It's a much more precise and refined way of treating disease.
Yeah. And this shift has the potential to transform how we treat everything, from autoimmune diseases to cancer.
Wow.
You know, we're moving towards an era of personalized medicine where treatments are tailored to an individual's unique genetic makeup and their specific disease profile.
That's incredible.
It is.
It sounds like we're on the verge of a major paradigm shift in medicine.
Yeah, I think so.
And Iscalimab is right at the forefront of that shift.
Absolutely.
It's like a glimpse into a future where we can treat diseases more effectively with fewer side effects and potentially even cure conditions that were once considered incurable.
Yeah, it's a really powerful thought.
It is. It's exciting to think about the possibilities, but it also feels like a lot of responsibility comes with this kind of power.
Oh, absolutely.
You know, as we delve deeper into the complexities of the human body and develop these incredibly powerful tools, we need to be mindful of the ethical implications.
Right.
It's not just about what we can do, but what we should do.
Exactly. And that's a conversation that needs to involve everyone, you know,
Okay.
scientists, doctors, policymakers, and the public.
Right.
We're all stakeholders in the future of medicine.
Well said.
Hmm.
I think this deep dive has really opened my eyes to the potential of Iscalimab
Mm-hmm.
and the broader implications for the future of medicine as a whole.
Yeah, I think you've done a great job of unpacking a really complex topic and making it understandable for our listeners.
Well, thanks. I have to admit, I was a little intimidated by all the technical jargon at first, but
Yeah.
once we started breaking it down, it became a fascinating journey of discovery.
Yeah, and that's what the deep dive is all about, right?
Yeah.
Taking these complex topics and making them accessible and engaging.
Exactly. So for our listener who sent us this article, I hope we've answered your questions and maybe sparked even more curiosity about this incredible field of research.
Yeah, and for anyone listening who's been touched by an autoimmune disease or knows someone who has, I think this research offers a real beacon of hope.
Yeah, I think so.
It's definitely something to be optimistic about.
Okay, so we've covered a lot of ground here. We've talked about the science, the potential applications, the economic factors, even the ethical considerations.
We have.
It's been a whirlwind tour of the world of Iscalimab.
It has.
Is there anything else we need to touch on before we wrap things up?
I think we've done a pretty comprehensive deep dive.
Okay.
We've explored the key aspects of Iscalimab and its potential to really transform medicine.
Right.
But one thing I always like to emphasize is that science is a constantly evolving process.
Right.
What we know today might change tomorrow,
Yeah.
and that's the beauty of it.
That's a great point. It's a reminder to stay curious, keep asking questions, and never stop learning.
Exactly. And as we learn more about Iscalimab and other groundbreaking therapies out there, it's important to stay informed and engage in the conversation.
Right.
The future of medicine is being shaped right now.
Yeah.
And we all have a role to play in it.
Well said. I think that's a perfect note to end on.
Yeah, I agree.
So keep those brains buzzing, keep asking questions, and join us next time on The Deep Dive as we explore another fascinating corner of the knowledge universe.
Until then, stay curious.
Okay, so as we wrap up our deep dive into Iscalimab, here's something I've been thinking about. You know, we've talked about how this could be a real game changer for people with autoimmune diseases, transplant recipients.
Right.
But what about the ripple effects? How could this impact the healthcare system as a whole?
That's a fascinating question, and it's one that researchers and policymakers are already kind of grappling with.
Yeah.
Because if Iscalimab really does live up to its potential, it could have a huge impact on healthcare costs, drug development, even global health equity.
Okay, so let's break that down a little bit. How could something like Iscalimab affect healthcare costs?
Sure.
I mean, would it be more expensive than the current treatments out there?
Well, it's a complex equation.
Okay.
Biologic drugs like Iscalimab are generally more expensive to produce than traditional pharmaceuticals.
Okay.
However, if Iscalimab can actually reduce the need for long-term immunosuppressants
Right.
or prevent those complications from autoimmune diseases,
Okay.
it could actually lead to some cost savings in the long run.
So it's not just about the upfront cost of the drug itself.
Right.
It's about the potential to reduce other healthcare expenses down the line.
Exactly. Yeah, it's about looking at the bigger picture, the total cost of managing these conditions over a patient's lifetime.
Right.
And that's where the real impact of Iscalimab could be felt.
That makes sense. What about drug development?
Yeah,
Could Iscalimab's success influence how other drugs are researched and developed?
absolutely, because Iscalimab's targeted approach, focusing on that specific pathway in the immune system,
Right.
could really pave the way for a whole new generation of therapies. I mean, we're already seeing a shift towards more personalized medicine.
Right.
And Iscalimab is a perfect example of that trend.
So it's like opening up a whole new avenue for drug discovery, moving away from those one-size-fits-all approaches we've seen in the past.
Exactly.
That's pretty exciting.
Yeah, it is.
But what about global health equity?
Yeah.
How does that fit into the picture?
That's a crucial consideration. We need to make sure that if Iscalimab proves to be effective and it becomes widely available,
Right.
that it's accessible to everyone who needs it, regardless of where they live or their economic circumstances.
Because a groundbreaking treatment doesn't do much good if only a small percentage of the population can actually access it.
Exactly.
So how do we ensure that kind of equity?
Well, that's where organizations like the World Health Organization and other global health initiatives come in. They work to ensure that these essential medicines are available and affordable in all countries.
So there's a lot more to this story than just the science itself.
Oh, for sure.
We're talking about potential economic shifts, changes in the way drugs are developed, and even this challenge of ensuring global access to these potentially life-changing treatments.
Yeah, it's a complex web of interconnected factors.
Yeah, it is.
And it's fascinating to see how something like Iscalimab can kind of trigger this ripple effect.
Well, I think we've given our listener a lot to think about today.
I think so too.
We've gone from the basics of what Iscalimab is to exploring its potential impact on healthcare, drug development, global health.
It's been a good discussion.
And I think it highlights the fact that scientific breakthroughs don't happen in a vacuum.
Right.
They have the potential to reshape entire industries and even influence the way we think about health and disease. That's a powerful takeaway. And for our listener who sent us this article,
Yeah,
I hope you're feeling as energized as I am about the possibilities here.
me too.
Iscalimab is just one example of the incredible innovation happening in the world of biomedicine right now.
Absolutely. It's an exciting time to be following this field.
It really is, and it underscores the importance of staying curious, staying informed, and engaging in these conversations about the future of health and science.
Couldn't agree more.
Well, that's all the time we have for today. But keep those brains buzzing, keep asking questions, and join us next time on The Deep Dive as we explore another fascinating corner of the knowledge universe.
Until then, stay curious.